Nancy Reipel came home today, landing just before noon at Dobbins Air Reserve Base. And just like Saturday, news choppers were overhead, tracking every move.
There you see the ambulance on its way to Emory University Hospital.
Unmarked law enforcement vehicles surrounded the ambulance in a moving formation.
We had SWAT team, we had bomb teams, we had K-9, and of course we had assistance from the University Police and FBI as well too.
The paramedic driving and two paramedics in back wore hazmat suits. Nancy Reipel emerged on a stretcher, encased from head to toe.
As noted yesterday in my commentary on the show, there is nothing more damaging and dangerous when it comes to the issue of Ebola patients in America than panic. Plenty of so-called news organizations, websites, and phony talk show yackers have spent the last several days whipping up everything from an uncontrollable outbreak in Atlanta to the government seeking to use Ebola as a weapon against illegal immigrants or its own people. Facts are harder to come by, or at the very least are all too often overshadowed by those using the issue for their own financial and egotistical purposes. So let's break through the noise and get those facts. Welcome back to MidPoint, the former Lieutenant Governor of New York State and a health policy expert, Dr. Betsy McCaughey.
Well, thank you, and I am glad to be here because the public really wants the facts.
Do they really want the facts? And I'm going to preface that by saying the media, the business that I'm in, we always say we feed the public what they want, and it would seem as if you turn on a lot of network newscasts, certainly the web is filled with it right now, and they're full of a lot of things sometimes, depending on who the person is writing it or speaking it, but it's all about panic, look out, pandemic. We hear all these things. Why? What are we so afraid of here?
Well, let me make it clear that the general public is not in danger, but there could be real danger for hospital patients and healthcare workers if a traveler unknowingly carrying Ebola arrives in this country and then seeks care at a hospital emergency room. Most hospitals in the United States are unprepared to contain Ebola. In fact, most of these hospitals are unable to contain common infections like MRSA, C. diff, VRE. Those are household names, and they are racing through hospitals, killing an estimated 75,000 people a year. So these same hospitals lack the rigor, the discipline to contain such a dangerous pathogen as Ebola.
Then why are we getting to this point then, where we have this disease in this country, where it is out of control in some areas in Africa, when we are still not ready for it? It would seem that other than the treatment of the disease itself, this is the bigger issue here, because certainly malaria is there, other pathogens are out there. We've heard about weaponization for years now from our enemies. Why are we so caught off guard?
Well, and there's been a false or mistaken emphasis on the fact that this is not an airborne disease, but none of the hospital infections I just mentioned, the top three, VRE, C. diff, and MRSA, are airborne either. They're all spread through touch, through exposure to bodily fluids, for example, or shedding in the case of MRSA. And that's what's so important to recognize here. An Ebola patient becomes contagious in the later stages of the disease when the patient is vomiting, incurring diarrhea, bleeding internally and externally. But a patient having those symptoms and appearing in a hospital emergency room could pose a real threat to other patients and to healthcare workers. Most hospitals are simply unprepared to stop this kind of pathogen. And let me add that the CDC is also unprepared.
If we are that unprepared, then why? Shouldn't we have been better prepared for something like this? And let's also look to the fact that if you are flying into this country at this point, should there not be better precautions than taken at the airports and the ports of entry to the United States?
Well, that's a very important question, but I'd like to emphasize the need for hospitals all over this country to improve their rigor and discipline, because the same techniques that are needed to stop an unfamiliar pathogen like Ebola could stop the hospital infections that are killing people all over this country every day. Let me give you an example. Clostridium difficile, the #1 hospital infection, is spread by rampant diarrhea. Invisible particles of fecal matter contaminate the surfaces in the hospital, and then another patient picks them up. That's the same way Ebola could be spread if a person unknowingly carrying Ebola is admitted to the hospital. And that's why the rigor and discipline needed to stop Ebola is the same thing that's needed to stop these other hospital infections. But I mentioned a moment ago that the CDC isn't prepared either. In 2003, a very dangerous infection called CRE, carbapenem-resistant bacteria, caused deaths and suffering in New York and northern New Jersey. At that point, it was located in one part of the country, but the CDC was so ineffective that that dangerous hospital infection with a mortality rate of about 50% has now spread to 38 states or more, as well as to France and Israel and other countries. So we know that the CDC are incapable of arresting the spread of dangerous pathogens.
I have about a minute or so left, and this is what most of Americans would want to ask then. The fact that hospitals are ill-prepared, whose fault is it?
Well, I would point to the CDC. Their lax guidelines give hospitals an excuse to do too little. We also know that the CDC, just of late, 3 incidents have come to light of the CDC improperly mishandling dangerous pathogens such as avian flu. So I question their ability to actually contain a pathogen like Ebola. I wish them well, but I was on a call yesterday with doctors and the CDC for an hour, and you could sense the anger among many doctors that they're being presented with this very big challenge. And one of the things they pointed out is that Emory University has the latest technology, isolation facilities that it took 12 years to build in cooperation with the CDC. Most hospitals do not have that kind of technology available, and they could be hit with a traveler unknowingly carrying this disease. That is the danger. Let's hope it doesn't happen.
Exactly. Show some thought process here. Be ready, but do not panic. I think that's always what we have to continue to push forward.
There's no reason to panic, but there is reason to re-examine our preparedness to stop infections of any sort in hospitals.
Wake-up calls are always important, and I think this is certainly one for how we treat certain diseases in our hospitals in this country. Dr. Betsy McCaughey, it's always a pleasure to have you on the show. Thank you so much. We'll talk to you again soon. All right, next hour in MidPoint, the realization that the war in Afghanistan is far from over for Americans. Next up, missing the point in the latest war on drugs in Major League Sports.